Reducing carbohydrates in the morning may benefit diabetics. Focusing on protein over carbohydrates may help regulate blood sugar for certain people. Diabetes affects around 422 million people worldwide, with type 2 diabetes accounting for 90 to 95% of cases. Some people are able to reverse type 2 diabetes with adjustments to their diet and weight loss. Reducing carbs at breakfast can help people with type 2 diabetes better control their blood sugar levels throughout the day. Diabetes, a disease affecting the body's capacity to process blood sugar, affects roughly 422 million people, according to estimates by the World Health Organization, WHO. Among people with diabetes, around 90 to 95% of all cases are type 2 diabetes. Although there is currently no treatment for type 2 diabetes, some people can manage it through lifestyle modifications, including nutrition and weight loss. Now, researchers from the University of British Columbia have found evidence showing that eliminating carbohydrates from breakfast can help people with type 2 diabetes better maintain their blood sugar levels throughout the day. This study was recently published in the American Journal of Clinical Nutrition, comparing low-carb versus high-carb meals. For this study, Dr. Jonathan Little, professor at the Center for Chronic Disease Prevention and Management and professor in the School of Health and Exercise Sciences at the University of British Columbia. Over a 12-week period, one group ate a low-carb breakfast consisting of roughly 8 grams of carbs, 25 grams of protein, and 37 grams of fat. The other group ate a higher carb breakfast of roughly 56 grams of carbs, 20 grams of protein, and 15 grams of fat. All breakfast options in both groups were roughly 450 calories. Upon examination, the research team revealed that study participants in the reduced carb breakfast group reported an improvement in their HbA1c, a critical marker of average blood glucose management. They also discovered that the improvement was no better than that of the control group, which was not on a low-carb diet. We expected lower blood sugar levels in the low-carbohydrate group. Our initial objective was to see reductions in A1C, average blood sugar levels over the past 3 months, which happened in the low-carbohydrate group, minus 0.3%, but were not significant when compared to the control group. Furthermore, some low-carb individuals were able to cut back on their glucose-lowering drugs. It was not one of the outcomes, and we cannot fully attribute medication reduction to the intervention, but surprisingly, 8 people in the low-carbohydrate group reduced medication, Dr. Little noted. Breakfast carbs have an impact on the rest of the day. At the conclusion of the study, scientists discovered that blood sugar levels in the low-carb group did not vary significantly during the day, implying that a low-carb breakfast helps stabilize blood sugar levels throughout the day. And they discovered participants who consumed a low-carb breakfast self-reported eating fewer carbohydrates at lunch and during the remainder of the day. According to the study, a high-fat, high-protein breakfast can influence eating behaviors throughout the day. Dr. Daniel Pompa, a cellular health specialist, stated after reading this study that the findings come as no surprise because increased sugar and carbohydrate intake are major contributors to type 2 diabetes. By consuming fewer carbohydrates with breakfast, we aren't introducing even more sugar into the body, so controlling blood glucose levels is more manageable, he stated. What I am saying is that type 2 diabetes isn't a life sentence if the proper lifestyle modifications are implemented, he stated. According to Dr. Little, these findings may lead clinicians to advocate a low-carbohydrate breakfast for people with type 2 diabetes. Scrambled eggs, an egg omelet, or non-sweetened full-fat Greek yogurt are all great options, he noted. What is type 2 diabetes? A person may have diabetes if their body cannot correctly digest their blood sugars, often known as blood glucose. There are 2 main forms of diabetes. Type 1 diabetes is an autoimmune condition in which the pancreas no longer manufactures insulin. Type 2 diabetes arises when the body does not make or use insulin correctly. There are numerous other genetic and environmental factors that enhance someone's risk of type 2 diabetes. Being over the age of 45 and having a close family member with type 2 diabetes. If a person has type 1 diabetes, they will need to deliver insulin to their body every day. With type 2 diabetes, people may or may not be required to give themselves insulin. They may also be required to take specific medications. Medicine may not be sufficient. While type 1 diabetes cannot be prevented, many occurrences of type 2 diabetes can be prevented through lifestyle changes, including weight loss, eating a balanced diet, and frequent exercise. People with type 2 diabetes are also at increased risk for developing other illnesses, including dementia and eye disorders such as diabetic retinopathy. Some malignancies, such as liver and pancreatic cancer. Carbs and type 2 diabetes. Carbohydrates are necessary nutrients that the body transforms into glucose for the energy it needs to perform. There are two main types of carbs. Simple carbohydrates have a basic molecular composition and are relatively easy for the body to digest. Fruits, dairy products, and processed sweet meals like candy, soda, and table sugar are examples of simple carbohydrates. Eating too many simple carbohydrates might cause blood sugar levels to rise. These surges raise the risk of diabetic complications in people with type 2 diabetes. Because complex carbs take longer for the body to metabolize, they do not trigger blood sugar spikes. Vegetables, beans, lentils, and whole grains are examples of complex carbohydrates. Why should you limit your carbohydrate intake at breakfast? According to Dr. Little, he and his team focused on eliminating carbs primarily around breakfast because a full low-carb diet is challenging to stick with long-term. The overall concept is that breakfast blood sugar spikes are largest after breakfast in type 2 diabetes due to the high carb content of the meal and the lingering effects of the dawn phenomenon, which make glucose intolerance worst in the morning for type 2 diabetes. If you only adapt the breakfast meal, you avoid the largest spike, and it is easier to stick to over time, he stated. We know that post-meal blood sugar spikes are linked to diabetes complications, particularly damage to blood vessels. Avoiding those increases throughout the day minimizes the risk of microvascular problems such as retinopathy and high blood pressure.